All right, so thank you so much, guys, for coming. We're doing lecture 17 today. We're going to talk about spinal nerves, and then we're going to talk about plexuses. Okay, plexuses are just the way these spinal nerves are bundled up. Okay, from the beginning, what did we start off with? The dorsal and the ventral root, and you had the what you call this rootlets, right, from the spine. And the rootlets combined, they form the dorsal root, which we say carries sensory information to the CNS. Okay, and that was kind of in your schedule when it was talking about what kind of axons do you find in the dorsal root? What kind of axons? You know what I'm saying? And a few people got that one wrong. So the dorsal root is carrying sensory information, and the ventral root is carrying motor, information. Okay, and then what did we say? The dorsal root and the ventral root join to form the spinal nerve. Okay, so now after the spinal nerve comes out of the spinal cord, then it's going to branch out. That's where we are now. That's the lecture today. We're going to talk about when it branches out. So when it branches out, it will branch to the back. So that will be like a dorsal branch. And today, instead of saying branch, we're going to say rami. Rami is plural for branches. Okay, or ramus singular. Okay, so it goes to the back, supplies the organs and structures at the back, and then there's another branch that goes to the front called the ventral rami or the ventral branch, and also the posterior anterior branch. Okay, and then so you have a whole bunch of axons. The bundle that goes to the front is bigger than the branch that goes to the back. And you can see a reason why immediately, right? What would be the reason why the branch that goes to the front is going to have a lot more axons in it, in the bundle, than the branch that goes to the back? What do you have at the back? Just skin and muscles. What do you have at the front? All these other organs, eyes, and whatnot. So you're going to need much more nerve work. So because there's just too much wiring going to the front, you're going to have plexuses. That's where the plexuses come in. It kind of makes a good organization of those branches. So that's what we're talking about today. All right, those complex networks of the anterior rami or anterior branches that supply the front of the body. Right, and so we'll talk about how these nerves are packed, and it's very, very similar to the muscles. You know when we did the muscles. Remember when you did the muscles, we said the muscle fiber is covered by the endomysium. Same thing. The individual axon fibers are covered by a connective tissue membrane called the endoneurium. Neurium from neuron, right? Okay? And so this is really nothing new. A nerve is simply a bundle of axons that are compartmentalized by these connective tissue membranes. Okay? Just like a muscle. Okay, and then we have the fascicles in the muscles, which are little sub-bundles of muscle fibers. We also have sub-bundles of these axon fibers, which are the long extensions of neurons, right? And they're covered by the perineurium, which is synonymous with the perimysium. Same thing. So this is nothing new. We've seen this kind of arrangement before, okay? We just apply it to the nerve instead of the muscle. Okay? Instead of mysium, which you said stands for muscle, you use the neurium, which stands for neuron. And that's it. So if I ask about the connective tissue coverings of nerves, you should answer that without even looking, right? Because you already know it. Right? And then, of course, the epineurium is one on the outside. Okay? So what's the deal here? We got the nerve here. Okay? That will be the epineurium. And then inside we've got the sub-bundles of axons called fascicles, covered by the perineurium. And then we got the individual axon fibers inside of this, right? Right? Like that. And the green would denote the endoneurium. That's it. And they're all bundled up like that. And in the middle, you have some fat, okay, which kind of sort of cushions and also adds a little bit of more insulation, right? Alright, so that's it right there, because sometimes I do ask about the coverings of these nerves. Okay, so I'm gonna erase this part so you can see what's behind. Alright? There you go. So there you go, we get our little rootlets, dorsal root, ventral root. Ventral root carries motor going away, and this carries sensory going towards. And then they join up to form this nerve now, which is bundled up by the epineural. Alright, just like a muscle fiber, right? And also more insulation comes from the myelin sheath, as usual. Right? On the myelinated ones, okay? And the ones that are not myelinated are still covered by those Schwann cells, just to insulate. So, you gotta know these coverings, and you gotta know which covering covers what part of the nerve. Alright? So we kind of talked about it last time. We said, the spinal cord is split into those regions, right? The neck region, we call it cervical, and then the thoracic region, okay, the thorax, and then the lumbar region, lower back, and then the sacral region and the coccygeal, the tail end. And we talked about how you've got 8 over here, all right? And today we're going to talk about plexuses, and the plexuses will come out of those cervical enlargements. What did we say was special about the cervical enlargement and the lumbar enlargement in the spinal cord? What did we say? Last time, when we were talking about the spinal cord, we said we get the cervical enlargement. What comes out of there? The cervical enlargement and the lumbar enlargement. We said it supplies the cervical will supply the arms. So that hence the enlargement, right? Because you are having a whole bunch of nerve work coming to, especially the hands, because the hands are used to manipulate, to touch, to feel, and so forth, more so than the legs. Because the legs, we just kind of sort of stand on them. The feeling on my palm is much more than the feeling on the sole of my foot. You know what I'm saying? So you have a bunch more nerve work up here. So here, you're going to have, all the plexuses we're going to talk about will coincide with those enlargements on the spine. Okay? Because that's where you have a whole bunch of nerve work coming out to do the job. Okay? So you're going to have in here the cervical plexus, right? And then you're going to also have the brachial plexus. So the cervical is kind of sort of supplying things up here, in the face, and then the brachial is going to supply, brachial to do with the arms, brachial, right? So it's going to supply the limb, brachial plexus. Okay, and I'll show this later on. But another thing you kind of had a problem in the module was, showing the different plexuses, the 5 different plexuses, which we'll talk about in a little bit. So I'm going to kind of sort of preempt and talk about it now. So you have here the cervical plexus, which will be C1 to about C4, right? And then the brachial plexus is about C5 to T1. Okay. So the first thoracic one will be that. I'll show you that again. So, and then we said there's only 8 in the neck region, okay? And they are divided up into those 2 plexuses, all right? And then the thoracic region is got those like T2 to T12, thoracic 1 to thoracic 2 to thoracic 12, supplying only here, the intercostals. You see how there's nothing really very complicated in this region of the body. So there are no plexuses coming out of that. You just have the intercostal nerves. That's it. Okay? Do you see what I'm saying? There's really nothing. It's just skin in those muscles. So nothing going on here in most of the thoracic region. No plexuses. All right? Then we come back now to the lumbar enlargement. So we're going to get plexuses, right? Because it's going to be supplying those organs down here in the lower limbs. So in the lumbar, we've got the lumbar plexus, right? Because it's going to be a bunch of nerve coming out there. The lumbar plexus, it's about L1 to L4, right? And then sacral, which is kind of sort of part of that enlargement, you've got sacral plexus, Okay, and so this is kind of, there's overlap. It's not all set into regions. So, about S4, right? So that's the sacrum. So this has got many spinal nerves coming from different regions. So one of the jobs of the plexus is to take all these nerves from different regions of the spine and bundle them up in the same bundle, going to that organ as a plexus, okay? Which then splits into the different nerves. And I'll show you. So the coccygeal one, we said it's not really a region. There's only one, right? And so, there's the coccygeal plexus. Coccygeal plexus, right? Which is kind of like S5 to, see, so it's only two, it's made up of two, okay? To see what, and I'll show you this again later on, okay? But I want you to see how first the spine is divided into these regions and the number, of course, of the spinal nerves coming out of each region. Sometimes I ask about that. Okay. Then I also ask about the plexuses. So those are the plexuses in there. And I'll show you later on. Usually the lumbar plexus and the sacral plexus, they're combined into the lumbosacral plexus. Okay. So that's where you get a bunch of the nerves coming supplying the leg, like the sciatic nerve, the tibial nerve, and so on. Okay. So these spinal nerves, all these spinal nerves, they are distributed such that, to the skin, one spinal nerve kind of has a certain area of skin that it innervates. And that's what's called a dermatome. Okay. So in the exam, sometimes I'll ask you to define a dermatome, and you guys would say it's the area of skin that is supplied by a particular spinal nerve. Okay. And I'll show you a map of that. And the map is kind of sort of random in some spots, okay? Like the forearm on the right is kind of supplied by different spinal nerves from the forearm on the left, whatever, okay? It's not like real mirror images and stuff. So a dermatome, the specific area supplied by a single spinal nerve. And I'll show you the map. There you go now. So I'll remove some of this deal here. It will come back again, don't worry. We'll do it on the side. You see what I was talking about? From about T2 all the way down here. There's no plexus because we just have the intercostal nerves. It's not busy. There's not many complicated structures in the torso area here, right? But the business end of it is down here. You got the genitals, you got all these things down here. And the legs, up here, you got all these deals in some of the parts of the face. Okay? So it's busy, so you get the plexuses, which is what the function of the plexuses is to organize different spinal nerves from different regions of the spine into a single bundle to go to a specific body part. Okay? So in the exam, I might say, okay, what's the function of plexuses? And that's what it is. Because these nerves are coming from different levels of the spine, and they are going to the same area. So what you want to do is bundle them under the same epineurium, under the same connective tissue, so it kind of makes sense of those networks. Okay? So you see the dermatomes I was talking about? You see how, it is color-coded? You see the T1 to T, it controls all this. So all this area is supplied by a nerve. Okay? If you're getting some sort of tingling in a certain part of your skin or something like that, it may be a problem with the spinal nerve that's getting pinched or something like that. And if you're complaining of maybe here, the forearm on this side, then it may be C8. The cervical, you did something to your neck and you know what I'm saying? But physicians probably have to refer to this map. Like I say, it's not kind of uniform in some spots, okay? Like the forearm is innervated differently on the right and the left. But anyway, just know that the dermatome is a particular area that is supplied by a certain spine. Okay? Alright, so now we're going to the plexuses. Alright. We started with our rootlets and then we started with our ventral dorsal root. the spinal nerve. Now it branches. The branches are called rami. Okay, so this is pretty much branches. You can interchange the two. I don't really mind. And singular, I said, is ramus. Okay, like that. These are Latin words. Okay. So the dorsal rami or the dorsal branches, they go and supply the back. Okay, and you'll see. I'll show you a picture. You will see of an actual cadaver. You will see how thin the branch that goes to the back is. Once the spinal nerve splits into the one that supplies the back, because there's really nothing much here. The one that supplies the front, which is the anterior or the ventral branch or rami or ramus, that is the thicker one, and you will see it visually without a problem. So it supplies the back, the muscles and skin of the back, from kind of like the middle towards, going towards the back. Lateral sides going towards the middle of the back. Okay, so we're not going to get any plexus when anything goes to the back. Later on, I'll give you a definition for a plexus, and then we'll talk about the anterior rami or ventral. Okay, so these are the ventral rami in the thoracic area, and we talked about how there are no plexuses in that area because it's just supplying the intercostals, the intercostal muscles that we're doing in the lab. So this thoracic region really, there's nothing much except the intercostal nerves supplying the intercostal muscles. So the muscles between your ribs. Okay? So no problem there. Now I talked about how the enlargements of the spine coincide with the regions from which the plexuses arise. Right? Makes sense? Because then it's going to supply the arms, it's going to supply the legs, and it's going to have a bunch of nerves going, a bunch of axons. Okay, so the cervical, of course, and then the lumbar and sacral down there, and also the coccygeal, ventral, rami. It's got to be anterior branches on it. Those are the only branches that form plexuses. Okay? And it coincides with the enlargements of the spine. Right? Cervical and lumbar enlargement. Okay, another thing about it is that the sympathetic system, okay, so here's our little spine, and you see my enlargements? Only the neck and one. These are what is called a paravertebral chain. Okay, paravertebral. Para means parallel, it runs parallel. Paravertebral sympathetic chain. Okay, so you have some fibers running up and down here. Okay, and they are parallel on either side of for the sympathetic system only. Remember when we were doing the nervous system and how it's organized, we said autonomic is split into sympathetic, parasympathetic, and enteric. So only the sympathetic ones, the spinal nerves supplying the sympathetic system, come out of the spine like that. Okay, and then these will also have cell bodies. Okay, of these neurons on the chain, on the paravertebral chain, and those are called the paravertebral ganglia because they are parallel to the ganglia cell bodies outside of the CNS, parallel to the vertebral column. So what you have is the spinal nerve comes out, okay, after the union of the dorsal and ventral root, okay. Then only for the sympathetic system there will be a branch or a ramus that will connect to the paravertebral chain for the sympathetic system only. That is what is called a communicating branch. See what I'm saying? We got the branches going to the back, which we call the dorsal branch, and the branch going to the front of the spinal nerve, which we said is the anterior or ventral ramus. Okay? But then there are little branches that have to connect to this paravertebral chain for the sympathetic system. Those branches are what I'm calling the communicating ramus. Okay? That supply the sympathetic chain. We'll do it because we're going to be talking nervous system until we finish. So we'll do it next time when we talk about the sympathetic system. Right? But so know that these communicating rami are those that connect, and I'll show you a nice picture after this. Okay, so I want you to be able to tell me about these branches and tell me which areas of the body they supply, okay, and which of these branches or rami will give rise to the plexuses, right? So I'll ask about that. And then of course be able to tell me about the communicating rami, which connects the spinal nerve just out of this spinal cord to the paravertebral chain for the sympathetic nervous system. Okay? So this is for the sympathetic. For the fight, flight, system, nervous system. So you see what I was saying? Okay, you got your root blades here, you got your ventral root, and then you got your root blades, and you got your dorsal root. So this is carrying sensory information, and this is carrying motor information. All right, and then they join to form the spinal nerve. Now, after the spinal nerve is formed, it's carrying both sensory and motor, neurons, axons. Okay, so it's now going to branch to supply the parts of the body. So some branching will go to the back, which will be the dorsal ramus. Okay, you see how thin it is compared to this one, and I'll show you actual pictures of the natural cadaver. You can see the difference is very, it pops out. And then this is the anterior branch, or the ventral branch, or the ventral ramus. Okay, if you want to use the terminology. Okay, so, and it's much thicker than that, and you'll see it in real life. Okay, and this is not supplying the front, the anterior. Okay, and the spinal nerves coming out of those enlightenment areas, those give rise to the plexuses. And then here is our sympathetic chain. You see how the spinal nerve comes and then branches like that? You see, those are the communicating nerves. See what I'm saying? They join that sympathetic chain from the paravertebral sympathetic chain to the spinal nerve. Okay? So that's good. So let us know all those branches, what they are. Okay. Do you see now how this is very thin? See, this is spinous process. So this is the back. Okay, and then you get that going to the back, and you see how thin it is. Look how fat this one is. The ramus, the ventral ramus, which is also called anterior. Okay, you can call it anterior. It's okay too, because you are referring to a biped or animal when you do that. And then the dorsal ramus is also posterior. Okay, and then you can see, the communicating rami that connects to these neurons in the sympathetic chain. There's two kinds. Okay, one of them is myelinated, so it's called white ramus. Okay, white communicating ramus. So you see what I'm saying? And the other one is non-myelinated. It is gray ramus. Okay, makes sense? Remember, myelination makes it white in appearance. That's what makes the white matter. So this one is a communicating. You see how this is the sympathetic ganglion. So that means it's a communicating ramus. It's two kinds. One is myelinated, which is white, and the other one is non-myelinated, which is gray. Okay, so gotta know that. And then these pictures, look at them, later on when you can, when you have time. But it shows you the ventral or the anterior ramus, which is the thicker one, and then of course the paravertebral, the intervertebral foramina, the ones that, when you stack. That's why sometimes if your discs, maybe there's inflammation and so forth, you could actually start to pinch on a particular nerve. Okay? Like I was talking in the morning about Tiger Woods, how he hit his back. When you're constantly swinging like this and you're twisting your spine, your vertebral column, the likelihood of there being some sort of inflammation and kind of some abrasion will start to mess up the discs, because this thing is arranged in a column, and if you're always twisting hard like that, it's easy to kind of put things out of whack, and then you start pinching on a nerve, and that's painful. Oh my God, because that nerve is constantly being stimulated and you feel the pain. Okay, so, and then of course our dorsal root ganglion and so forth, so you know about that. All right, so now we'll talk about the major plexuses. And then we'll talk about the kind of nerves that come out of each of those plexuses. So this was what was in your module, your lens part modules. It was asking about the major plexuses in the body, and it gave you one, and you're supposed to fill the rest of it. So, like I was saying, in the cervical enlargement, in the neck, you've got the cervical plexus, and it's C1 to C4. So the first 4 spinal nerves coming out of the cervical region contribute to the cervical plexus. Okay, and like I said, there's a bit of overlap here. Okay, but the phrenic nerve is mostly coming out of the cervical plexus. Okay, but the phrenic nerve, we said, it controls the diaphragm. Okay, so the phrenic nerve really starts from C3 to C5. Okay, so 2 of those nerves are starting in the cervical plexus, so that's why we kind of put the phrenic nerve under cervical, because 2 of them coming out of the cervical plexus. But it really borrows one, the first of the brachial plexus, C5. Okay, so the phrenic nerve comes from C3 to C5. All those spinal nerves will bunch up to form the phrenic nerve, which controls the diaphragm. Okay, and then the brachial plexus, brachial arms. Okay, and there's 5 nerves that come out of that. Okay, and it's C5 to T1, right? C5 to T1, it borrows one of the thoracic ones. So you've got one nerve that comes out, you know, and supplies the armpit area, which is the axillary. Okay, then the one that kind of supplies the ulnar. Okay, so the ulnar nerve, the radial nerve, and the one that supplies the skin of the forearm and muscles, so the musculocutaneous. Anything cutaneous is to do with skin. Musculocutaneous, so that's the 4th one, and then the median one supplies, you know, the arm. Okay, so sometimes I do ask about what are the nerves that arise from the brachial plexus, the new distal spine. Sometimes I ask about what are the 5 major plexuses in the body, and from which region of the spinal cord they come from. Then you say cervical plexus, C1 to C4. Okay, you can use abbreviation this time for C1 and C4. You don't have to say cervical 1 to cervical 4. Okay, you do that, and then brachial plexus, then you say C5 to T1. Okay, but here you've got the axillary, you've got the radial, you've got the musculocutaneous, you've got the ulnar, and for the most part, the name of the nerve will tell you the body part that's being innervated by that nerve. Right? Make sense? Okay, so in the exam, I'm not going to expect you like what the module was doing to try and tell you, okay, this nerve, which part, which muscle is it supplying, or which, you know what I'm saying? I'm not going to expect you to know that, but I am going to expect you to know the general area that is innervated by that particular nerve. You know what I'm saying? Because it's in the name too. Okay, so like this brachial plexus one, I mean, the axillary nerve will kind of supply the skin of the shoulder, because it's right, the shoulder is right by the arm. Okay, things like that. And then the lumbar, L1 to L4. So 4 of those 5 lumbar spinal nerves give rise to that. Okay, and then this is kind of a big one, the sacral one, L4 to S4. Okay, so L4 to S4 is a little bigger than this one because it has more spinal nerves. And I'll show you how these are coming from different levels on the spine, and then they're being handled as a plexus, and then the plexus will then split into the different nerves. You see what I'm saying? Okay, so, and I said earlier on, these 2, lumbar and sacral, are normally grouped as the lumbosacral plexus. Okay, lumbosacral plexus. But you should know that there are 5 major plexuses in the body, and from which regions on the spinal cord they come from, because I'm going to expect you to know that. Good 5-point question, don't you think? Right? I'll expect you to know that. And then, of course, the coccygeal only has the S5 and C0. C0 is the only coccygeal spinal nerve. Okay, so not in C0. That's, okay? So, gotta know that. And then, of course, there are more nerves. There are also nerves that come out of the lumbosacral plexus, okay, including the obturator. And you know, we all know which structure that goes through, right? The obturator nerve goes through the, what's that? Obturator foramen, right? Remember, we did it already. So some of this terminology, you've already been exposed to it because they are named after the region in which it is innervating, or even the blood vessels regions they supply or drain. So once you learn it once, kind of builds up and you shouldn't have anything wrong. And then of course the femoral goes to the femur, to the thigh muscles. And then the tibial one, you will know that it has to go to the lower leg because that's where the tibia is. And the fibula, the common fibula, is going to be down there. You see what I'm saying? So if I ask those general terms, like the common fibular nerve, what does it innervate, you should be able to tell me generally where it's going, lower leg, right? That would be good enough for me. You see what I'm saying? And the femoral one would be the upper leg, right? Make sense? So that's the level of knowledge I expect you to, in terms of the areas of the body that is innervated, the general area, okay? And right now, when we go to the lab, we're going to soon be dissecting the thigh muscles. That's where we're going to see this. So the tibia and the common fibular nerves join to form the sciatic nerve. It is thick, you can't miss it. It's so thick, even if you don't want to see it, you'll see it. As soon as we split the thigh muscles, you will definitely see it. It's that thick. So you can imagine how thick it is in a human being too. Okay? It's going to be much thicker. And it's like right there. In fact, you've been seeing them on those cadaver pictures. So sometimes when you have sciatica, you have that pain that goes to your butt, and your glutes, and kind of goes down there. It's irritation of the sciatic nerve. Okay? Which is made up of the tibial and the common fibular nerves will join up and will run the length of the thigh towards the back. That will be the sciatic nerve. So that's the sciatica disease people get comes from that. So of course, know these nerves that come out of the lumbosacral plexus. Yes.
And those nerves have to do like when, like for example, your leg falls asleep on you,
when it falls asleep on you, the nerve.
Or like when people say, "Oh, my leg fell asleep."
Yeah, there might be some, something interfering innervation of that. It could be anything. Sometimes, let's say a certain muscle, like you see these nerves are going between muscles, is inflamed. It will inflame the nerve too. You see what I'm saying? And then, because it's the general area that's inflamed, and then, it could cause problems. It could send some signals that would be interpreted as pain. Like the sciatica, when you have that sciatica thing, it kind of comes on. I don't know if anybody has ever had it. Mostly it occurs in elderly people. You know what I'm saying? Because sometimes they have the shingles, which is like a nerve that it's very painful. That is infected by that virus. It's the chickenpox virus does that. So sometimes some nerves are blocked or something, and then it's no longer innervating that particular body. So that may be considered as nodding off, if you will. Yeah. But the etiology of it is it could be anything really. It could be pinched up here by the spinal cord. It could be some regional inflammation or a disease or something affecting that area that will then affect that nerve and the area and the parts that it supplies. All right. So know all the nerves coming out of the lumbar region, and of course what makes up the sciatic nerve, right? And then all the nerves coming out of the brachial plexus. Okay, there's 5 of them. Okay, and then of course know the general regions for each of these major plexuses in the body. Okay, and from where on the spinal cord these plexuses arise. Those are the questions I'll be asking you. Okay, so in these pictures, you'll be able to see how fat those nerves are. This is an actual cadaver, you see what I'm saying? And you can actually see the veins. You see this subclavian vein here. You see how thick it is? And I'll show you the picture of thorax that's been dissected out. And you can see, but these nerves are thick. See that? Those cervical nerves. Look at that. You can see them. So that's why sometimes when they have those prostheses, you know how when you get your arm cut or something, you go to hurting war or whatever, or bomb blow up on you, and they cut off a stump. They're now going to these bionic arms. See what I'm saying? So what you do is you take all this axillary radial, all those nerves, you hook them up because they're all electrical wires, really. And then you hook them up to this prosthesis, and then you could actually manipulate your fingers when you think about it. Because what is it going to do? it's going to stimulate that particular nerve, and then the information will go to the prosthesis. That's why some people who have their legs amputated, they have what's called phantom pain, because they'll be feeling the big toe, but their leg has been cut off here. You see what I'm saying? Because it's the same nerve that would have continued all the way to the big toe. See what I'm saying? Because of that. So it happens probably the first time you are amputated, because you're used to having that limb there, and the nerves have just been truncated, but they were going where they were going. So you could actually stimulate and feel the sensation of something is moving you, but it's not there. It's kind of freaky like that. So that's, yeah, it freaks the crap out. But you can connect these nerves, and then you could use it for prosthesis. When you think about it, and then it will go. So that's good technology that's coming up these days. It's because you have to know your anatomy and how these nerves come out, so you can be able to hook them up. So people like that do engineering, and then they do medicine together. So they do medical engineering. You know what I'm saying? So that's a cute. If I could go back and do that, I would run back and do that, because it's kind of interesting. Anyway, this is you see that rises from C3, C3, 4, and then 5, C1, 2, 3, and all that make up the phrenic nerve, and the phrenic nerve goes to the diaphragm. Have you seen people who are perpetually hiccuping? Those guys, the phrenic nerve is one that's acting up. So it's kind of sending impulses spasmodically like that, and then it will cause the diaphragm to go like this, and you hiccup. Okay? So sometimes you could use some electrode therapy or something like that. You stimulate this to stop that unnecessary activity that might stop the diaphragm from contracting like this. You see what I'm saying? So, because there are people like that who have a problem of hiccuping constantly. It's not stopping because of the electrical activity. Alright. See what I was talking about earlier on? You see this goes through, and I think when we do the circulatory system, you'll be able to see the phrenic nerve. In the cat, you'll be able to see it. So the human one will be even thicker, right? And the phrenic nerve only has these 3 spinal nerves coming out, okay? You can see the heart here. See, this is the aorta, okay? And then those are the veins, okay? The superior vena cava and the subclavian. You see that? So these are very big veins. When they do open heart surgery, they just cut these major veins off, as long as the valves up here are good, and then they just hook the next heart, and then they suture. The aorta is humongous, it's huge. See what I'm saying? And then they just suture that up. That's another interesting, field, open heart surgery, cardiology. But you can see that. Look at those pictures later on. You see now, this diagram shows exactly why you need a plexus. You see that? You see how you have this here, that there, and that they're supplying just the median nerve. You see coming from all this part, and you see how it's colored up. So what a plexus does, it will bundle up all these guys into one bundle, and then the nerves will start to come out, the median nerve, the axillary nerve from the brachial plexus, and then the musculocutaneous nerve. See what I'm saying? Rather than having one come there, and you make a small branch called the musculocutaneous nerve, and then it goes. You know what I'm saying? That will create too much confusion. Okay? But if you bundle it up in a plexus, then you have the various nerves coming out of that. Because these are coming from different levels on the spine. You see what I'm saying? If it was like that, like the spinal nerves in this area just supply this area, maybe you may not need plexuses, but you have one here, one there, one there, one there. They get bundled up and they go to the same point. Okay, so that's where the plexus is coming. Okay, so you can see, how thick they are. Alright, and then you bundle all that up. And in each of those, there's a bunch of axons going back and forth. You see what I'm saying? Right, and then lumbar plexus, again, you see how it's all, you can trace them, later on when you get time. You see how it's coming from different places, and then it's forming the femoral, it's forming the obturator and whatnot. Okay, so the plexuses are very important for kind of arranging these complex networks so that they make sense. And of course here, like you see, the tibial and the common fibula join up to form the sciatic, and it forms an even fatter nerve bundle, right? and it runs along the length of the thigh. Okay, so that's in the double sacral coccygeal plexus. So this is just showing you the brachial plexus again. So now I'm going to give you the definition for the plexus. So what is a plexus? Plexus is complex networks, right? Complex networks of anterior or ventral. Anterior and ventral are the same thing, right? Rami, if you want, or branches, complex networks of anterior branches of spinal nerves. Okay, because these the plexuses have nerves coming from different regions of the spine, different levels. So that's what this is trying to say. You have intermingling of different spinal nerves, you know, like C5 to T1, for instance. You see, and then those are getting bundled up into the plexuses. So this here is trying to say this, you know, these complex networks of anterior branches of the or anterior rami or ventral rami of the spinal nerves. You have to say anterior because we just saw how small those dorsal ones. There's not really much nerves going back to the back because it's just muscle and skin. It's not a lot. Okay, so all these from different levels are combined into form axons from different levels, carrying both sensory and motor, because it's a mixed nerve, right? It's carrying both, going back and forth to and from the brain. Okay, so this helps to make sense of that, of those networks. The plexus function is to organize these complex networks of spinal nerves, branches of the anterior branch. Because the anterior branch is a thicker bundle, most of the nerves are going to the front. Okay? So I'll remove my definition for plexus. In the exam, if I ask about plexus, I want you to talk about these very complex networks. Okay? I might even add from different levels of the spinal cord. Okay? That are formed, coming from different levels of the spinal cord, from the anterior branches. It's got to be anterior branches, okay? So there we go. The brachial plexus just demonstrates how complex that can be, okay? Because the brachial plexus gives rise to 5 nerves, all right? You see the axillary, radial, musculocutaneous. You try to this one. You see this one comes from there, and it comes from there, and it comes from there, and it produces these 2. Radial and axillary. You see that? And then some other ones come from another place, and they form different. You see, one comes from here, and one comes from up there, and then it forms the median nerve. Okay, so that's why you need to bundle them up in a plexus, and then you have the nerves coming out. Okay, because this is the most complex one because it supplies the arm, and the arm does a lot of things. It manipulates stuff. That's what we use to feel everything. So the networks of plexuses here are more elaborate. Make sense? Right? Okay. I know your module attempted to ask you to talk about what each of these nerves are innervating. Okay? But for purposes of the exam, like I said, I just need you to know the general area that is supplied by each of these nerves, rather than the specific muscle, okay? Because that would drive you nuts. But anyway, this kind of sort of exemplifies again the brachial plexus, okay, and how it innervates all those muscles like the lateral head of the triceps and so forth. The brachioradialis, remember the brachioradialis is one of the 4 arm muscles that we're doing in that practical thing. I'm not going to expect you to know it to that level, okay? I just need you to know the axillary region is in the shoulder area, okay? And then, of course, anything to do with ulnar, radius, radial nerves, it's going to be the forearm, right? Because that's where the radius and the ulnar are located, right? Makes sense? So that's all what I need you to know, and I will ask about that. Don't quote me on that. They say, oh, you should have asked that. And then you study only that. Because I'm going to tell you a lot of things, but I do ask about it sometimes. I do. And I'm not even lying. Okay? Because I never lie to you guys. Okay, guys? Anyway, that's my little joke for today. Anyway, like I was saying, you see how this forearm is differently colored from that? You see what I'm saying? It's not like mirror images. Like the forearm on this side is innervated differently from the forearm on the other side. See what I'm saying? So doctors usually probably have to refer to them maybe a couple of times because they're not always looking at it and dealing with it. When a patient presents to them and say, oh, this is that, and then to say, oh, which cranial nerve, which spinal nerve is that? You know, you still have even the hand. Look at it. You get the pink here, and here it's blue. So it's a different nerve that innervates. You see what I'm saying? It's different. So you just have to see. And the sole of your feet, you know, it's like that. Okay, and so forth. So anyway, these are the dermatomes that we were talking about. The particular areas that are supplied by particular spinal nerve. Innervated. And so this is like a summary table showing exactly what each of those nerves supply and you know and muscles and so forth. Okay. The chronic one, I will need for you to know that of course it comes from C3 to C5, mostly cervical plexus, but it comes a little bit from the brachial plexus, right? And it innervates the diaphragm. I need you to know those things. I need to be specific about that. But some of the other nerves, like the axillary, I don't want you to be really specific. Or it does the lateral head of the triceps, just the general area, like the shoulder area, and so forth. Okay, so those are all the ones for the brachial plexus, and then of course the ones for the sacral plexus. All right. So and you can look at this later on. But definitely know the major spinal, the major plexuses from which regions do they come from on the spine, and also the nerves that come out of these two plexuses. Now the sacral one and the brachial plexus, and a little bit of cervical, because the sacral is pretty cool. So thank you guys. We'll see you maybe correctly if you like. So we get a little bit. You like that? And then we get to work on it. All right, guys. Thank you, guys. I appreciate it.